We're glad you're tuning in here on your hometown radio station WYYZ Jasper for another episode of Wide Open with Dr. Sylvia Atkinson from Jasper Dental Associates. Hi, Dr. Sylvia.
Good morning or afternoon, I guess.
Yeah, it is
It
afternoon.
catches up with me.
Days get away from us, don't they? Now, if y'all tuned into the last show, last Saturday, we're just asking some general questions. That's what we're going to do again. And y'all are always welcome to go on the Facebook page, the Wide Open Facebook page, and view or listen to all the shows there. And you can comment your questions or message them to Dr. Sylvia or, call the Jasper Dental Associates office with any questions y'all might have. All right, but we're going to go over some questions. Now, as a dentist, what are the most overlooked problems that you see with your patients?
Well, I think that, and it sounds ridiculous, but I think oral hygiene has to be the biggest problem with the simplest solution. And in other words, I realize that we learn from our parents how to care for ourselves and personal hygiene, but we see still adolescents who aren't brushing their teeth, and they have the first stage of gum disease, which is gingivitis, and their gums are red and bleeding, and then they'll brush and say, oh gosh, my gums are bleeding, I better not brush. No, please do. That's why they're bleeding.
Right.
And it's truly a basic personal hygiene step that we understand and completely empathize with people who have issues that make it more difficult, whether it's a substance abuse problem or disability, physical disability, or health issue that has taken somebody down, literally. But it's a routine the key word is routine or habit. And if you can teach a young person how to just make that a part of their daily routine, and the minimum amount of brushing should be for 2 minutes once a day. That's like the minimal amount for keeping your teeth clean. Ideally, once in the morning, once at night, before you go to bed, especially.
And don't put anything else in your mouth after you brush them.
Not unless we told you to put some fluoride on your teeth. Right. Absolutely. And through the day at work, I'm brushing my teeth, more often because obviously it's ideal for me to present myself as a dentist with nice, clean, healthy teeth and gums. But one of the tools that I use myself is the Sonicare toothbrush, and I've talked about it before. Philips makes it. They don't pay us to say this. It's a great product. It does all the work for you. You just have to learn to tolerate the vibration because it is a sonic action, like a jewelry cleaner. And it has a timer. So if you turn it on and use it till it shuts off, you're going to be brushing for 2 minutes. Foolproof.
Right.
You can take it into the shower because it doesn't matter that it gets wet. And I'd say that's the biggest, most important tool that we try to get people
your hair,
to take with them when they leave our office, especially if those young people are in braces, which makes it even more difficult.
Of getting in all those
and then I'll say the most frustrating thing for me lately is seeing that my demographic senior patients, and I'm in that group now, I'd say 50 plus, things change just like the rest of your body. And I think it's difficult for people to realize that, well, that's what's happening. And it can change in a way that makes it more difficult to keep your teeth clean. Your roots could be exposed. The root surfaces are softer. The enamel's not covering them. They are more vulnerable, and therefore cavities can start and go faster. And I'm always surprised still that I see somebody who looked great in an x-ray a year ago now have huge cavities in between the teeth. So that requires a new set of habits. And I can see that that would be difficult. It's more important to floss between your teeth. It's more important to use perhaps another tool such as a water pick to clear larger debris. Fluoride to strengthen those root surfaces that are now exposed to the bacteria in the mouth where they were not when you were young. Being more meticulous about your diet and how you brush and floss and care for your teeth as we age. I know that that may seem simple, but that's what we see. Can you think of anything else, Ava, along those lines?
What are there a lot of things that are commonly misdiagnosed with dentistry? Like you come in, like a patient comes in and you find a major problem that they've been told wasn't that major and didn't take care of it. And
gum disease is a big one.
okay.
I see folks who've been to a dentist within the last year, and I will often say, has anybody told you that you have signs of gum disease? And am consistently, I'm no longer surprised to hear them say no. Even though I can see it on the x-rays, I can see it in the mouth, it is clear to me, but nobody's told them. And I don't know if this is fear on a dentist's part of displeasing someone to tell them that news, or again, we go back to people thinking that we're saying these things to get money instead of caring for a person. But I hear that a lot. And another thing that's difficult, I think, in dentistry is to diagnose a cracked tooth. I mean, I struggle with it myself because it can be, a person can have a fracture line in a tooth that's visible but be asymptomatic, no pain, no signs. They can come back a week later with it broken in half. There can be symptoms, which is very hard to see the cause of, like a fine crack that I can't really see very well even. So it's a communication between the person and the dentist. I had a gentleman I saw, I've known for a few years now and care about. And I saw him yesterday just for a routine checkup. I'd seen him a few months ago for symptoms on a tooth that had a root canal therapy, and it had an existing crown on it. And in that particular case, I thought, well, it sounds like maybe the root or the tooth is broken under here. And my solution to that would be to extract the tooth and put an implant. But apparently another dentist, he got another opinion, which I think is perfectly fine. And they had removed the crown that was on it, replaced it with a new crown, and he feels better. I honestly don't know why. Because a crown, an existing crown, in my experience, should not have been creating discomfort. And if the tooth had already had a root canal therapy, there shouldn't have been any symptoms of pain and discomfort unless there's a fracture.
Right. So
what I said is, I'm just glad you're okay. And, I'm just glad you feel fine. Everything else. It's not black and white always, and it can be difficult and can be frustrating for those of us who are trying to help.
Well, I'm going to touch on something that you did just briefly a minute ago, and this is a total surprise to Dr. Sylvia. You mentioned tooth damage from drug addiction.
Yes. There's
y'all have seen it. You have. You can tell, and it can be pretty horrible. Guys, if you had that problem, move on. Bless you. If you've gotten clean, go have them fixed. It will help you stick with your recovery. I've seen it.
It helps your self-esteem.
It helps your self-esteem. It helps you move on with your clean and sober life and make things a lot better. And you don't feel. I've seen this happen. Is why I wanted to touch on this with a family member. And the confidence level and the desire to stay clean so much elevated after He had the damage repaired. That I believe it was a very important part in the recovery. So guys, get back the credit care. Am I saying it?
Care credit.
Care credit. I was doing it backwards again. Get the care credit card. Do what you have to do to get that fixed, and it will help you move past whatever
a
problems
difficult time
that you had. Yes.
And I will say in regards to your question about misconceptions, that there is an idea. There have even been billboards, correct, with photographed before and after someone who's addicted to meth. The meth or drug or substance of abuse is not what's causing the damage to the teeth. It's the lack of care. And when someone is high or drunk or otherwise out of touch, they don't care so much about their personal hygiene. And the teeth aren't being cleaned. And over time, the damage is done. So it's not the medication. It's not the substance. It's the.
Huh.
So I'm sure you could have a very dentally healthy drug addict if they were perhaps a dentist who was also
right.
Had an issue with substance abuse. They were still going to probably keep taking care of their teeth unless they're completely out of touch. There's another misconception that I've heard more than once, and that is, I've got a calcium deficiency, or when I had my babies, my teeth went bad because, no. There are some developmental issues when it comes to the enamel formation of teeth that can be seen when a child is young. My daughter even is an example of this. But typically, it's that you're not cleaning the bacteria off of your teeth. It's so simple, and I keep going back to it because of that. There are other tools, and I'm going to throw one more out there to you, Ava, before we go. We call it disclosing agent. It's a dye. It's like a food dye. You may have had it when you were a child in a dental practice, and they dyed your teeth
pink, chewable
so that you can
tablets,
see what
yes.
you're missing. We still use it. And if anybody's interested, they can get it and take it home so that they can see where they're
see
missing.
what you're missing and make sure to concentrate
And it's
more.
important. We try to be your coach because we can't go home with you, or in most cases we can't. My husband probably sometimes can't stand that his dentist lives with him, but most of the time we can't. And he doesn't like it when I tell him to, hold a toothbrush a certain way. But we like to coach you and help you better take care of your teeth.
Well, and he's got a beautiful smile, so there you go. All right, well, I think we're about ready to wrap up this edition of Wide Open with Dr. Sylvia Atkinson. Y'all make sure you go by Jasper Dental Associates. Give them a call, pay a visit, find out what they're all about. Great bunch of folks over
We're
there.
happy to help you. Call us or send a question in to either my message on Facebook or to the program's messenger on Facebook, or even post it when you listen to a segment, if you do listen to a segment. We can be located at 938 West Church Street, Suite 104. Our phone number is 706-692-2611. We're there to help.
All right, and thank y'all again for listening to Wide Open here on your hometown radio station, WYYZ Jasper.